All right, we're back with another Mo Monday, and we are continuing with our men's health series, and we are talking about BPH, benign prostatic hyperplasia today. And this is a condition that does increase in risk of developing as we age. And basically, it's the size of the prostate that is enlarging, and it is something that is around the urethra, which is the passage of urine from the bladder outside. And as it enlarges in size, it potentially can impede the passage of the urine. It also will cause the muscles in the pelvic region to be dysfunctional and causing more contractions. So causes symptoms for some individuals, but not all. So what are some risk factors? And age is a big one. Age is a big risk factor as we get closer to 40 and after. And somebody in their 80s has about 80% risk of having BPH symptoms. And other things would be elevated blood pressure and diabetes and being sedentary, not being active. And so that takes us to some of the symptoms because you may not have any symptoms even if your prostate is enlarging. But the symptoms do develop in some individuals, and as things progress, and some of those includes going to the bathroom more often, having a weak stream, getting up in the middle of the night to pee, or having difficulty with incontinence at times, and sometimes recurrent urinary tract infections because of that. But urine flow is being impeded with the prostate sometimes. And so, what typically is done is an exam at your primary care doc's office, and the prostate is filled to see if the size is enlarged, if there's any lumps, bumps, and typically that is how it's diagnosed. It's mostly symptom based, so we'll give you a questionnaire regarding some of your symptoms, and the next steps is typically some lifestyle modifications that can be supportive of your recovery, and increasing activity and movement is an important one. Maybe front loading your water intake during the day would be important as you are wanting to avoid having a full bladder when you go to bed. And reduction or elimination of bladder irritants would be important. So alcohol and caffeine being the two big ones. In addition to that, obviously pelvic floor muscle exercises would be something that can be discussed with a therapist. And there are certain foods and supplements that can be supportive of this process. And pumpkin seeds is an example of one. And also stinging nettles root is another one that can be considered in tea form. They have phytochemical properties and reduce inflammation and is supportive in this matter. Now, when it comes to medications, there are medicines that help reduce the amount of muscle contraction in different tissue in the prostate and the surrounding muscles to help with reducing some of these symptoms, with the urinary symptoms that one would experience. And beyond that, obviously, if that is not supportive or someone is having continued symptoms, incontinence, urinary infections, then the next step would be to have a procedure or surgical correction. So if you have any further questions about benign prostatic hyperplasia, feel free to reach out. And if you would like a meet and greet with one of our providers, let us know. Have a great one, and we'll talk to you soon.